What is rehab or rehabilitation? My name is Fred Bigueras, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. Do I want to be good or amazing? This was a big question I started to think about as I started to change my career path. Did I want to be good or did I want to be great? When I was working in an insurance-based model, I definitely had plenty of patients, which I guess is technically a good problem to have as a young attending just starting out. There's advantages to having a lot of patients to see, especially when you are relatively new. But at some point, the sheer volume of patients that I was starting to see on a day-to-day basis started to get to me. The level of care I wanted to give was difficult, to maintain when you're seeing, 20, 25, 30, and sometimes 40 patients a day. As a physician, pressure is considered to be normal. Seeing 25 to 30 patients, if not more, per day is a pretty typical pace of work. You're hustling from room to room, missing meals and bathroom breaks, and you're just trying to help as many people as you can, putting in all the orders, typing out the notes, putting out fires on a day-to-day basis, and then you get home. Looking back, residency was a different kind of busy, but again, very normal. As a resident, you work hard, plus you see your senior attendings or mentors working at a similar pace. That is how they practice and the bar you aspirated to be at. I remember thinking, how can they see that many patients and, essentially juggle everything, and they seem to be pretty comfortable. It almost looked effortless at some point to them. So again, when you get out of your training, residency or fellowship, you think that this is normal. At that point, the people that have the most experience, the people that you're learning from, you think, they're simply amazing to keep up that pace. But, their patients are getting better. That's the way it is. So you don't really question the process. But at least in my experience or journey, I started to question how much effort and time was being invested for each patient, especially as life got more complicated. I started to question what level of care I was providing and what level of care I was not comfortable providing. As I saw more patients, I noticed that with one or two patients, I could be an amazing physician, but you obviously cannot run a practice and pay bills seeing 1 to 2 patients per day in an insurance-based model. So naturally, I increased my volume. Everything was fine, but there was a tipping point where I could tell that quality was starting to become harder to maintain, or the challenges of a busy clinic started to affect my judgment. The big concern is that it starts to affect your overall demeanor and attitude with your patients, and sometimes you carry that over to your home life, which also is obviously not good. I consider myself lucky because providing good versus excellent care was always an easy decision for me. Even when I was in a pure production-based model where there was a financial incentive for me to see more people, I never really felt comfortable making that leap because I could see that my attention span and focus started to wane as I traveled from room to room. If I were to work with a physician assistant or a nurse practitioner simply to see more people, I never really liked that idea because it felt like I was not being, essentially, I felt more disconnected from the patients. If I was, splitting time working with somebody, taking care of a patient. Even though I knew the answers to their questions, I could technically float from room to room, check in, here and there, but I know that that's not exactly how patients want to be taken care of. It's not how I would want to be taken care of. Patients want someone that they can trust, someone they can develop a relationship with, and that takes effort, time, and patience, all of which seems to disappear with higher volumes. Fortunately, I realized this at my last employed position. I was simply at a tipping point. I could continue to see the same volume of patients and provide, really good care, but was good care enough? Because more importantly, was good care sustainable, not just for patients, but for myself? Ultimately, it comes down to personal standards. From my own personal standards and what I expect out of myself as a physician is I want to be completely invested in the decisions that I'm making. To me, this equals excellence. Once I decided I wasn't going to settle for anything less than excellence out of myself, I had to look at the system I was working in. Was working in this system or environment conducive to my ability to be excellent? The answer in every position I worked in was simply no. I worked in several types of employment or settings. My first practice was a multi-specialty surgical group. I then worked in an academic institution. From there, I went to a military base working with active duty military. And then eventually I ended up in a pseudo solo private practice model. Again, all of these were very high volume models because majority of them are insurance based with the exception of the military position I held. But no matter who the employer was, no matter if it was insurance based, the bottom line is that none of these environments were conducive to me being an excellent physician the way that I knew I could be. It's not entirely the fault of the situation, but I know that for me to operate at a level I can be proud of, excellence had to be grown somewhere else. That was probably the biggest driving factor in me opening my own practice. I wasn't practicing the way I wanted to anymore. It wasn't about money or reimbursement. Even in this situation, the only way to become excellent in an insurance-based model is to see fewer patients, which meant taking home less money, and that felt counterintuitive. I was providing better care, seeing fewer people, and essentially the incentives were not aligned. I ended up spending more time with patients and getting paid less. It didn't really seem to make sense to me. For anyone that's listening to my podcast, I truly do appreciate your support. I hope that my content gives you something to think about. Not too many physicians are okay with their current working situation, which is typically in an insurance-based model. It's a high volume model, and high volume models operate at a certain pace. And in the current landscape, reimbursement is only going lower, and there's more people to take care of, and the only way to keep the lights on is to see more people when you're getting paid less. And ultimately, that's just the only way that I've ever seen a high volume model work that's insurance based. It's the only way that you can really keep up. But overall, I think it's important for all of us to ask ourselves what level of care we expect to give our patients and what level of care we are okay delivering. But overall, I think it's important for us to ask ourselves what level of care do we expect to give our patients, and is it a level of care that we can be okay with? We can sleep at night. Providing excellent care does have its drawbacks. It's hard, it's mentally draining at times, as is a high volume clinic. But, thinking less about our patients and providing less care can sometimes seem appealing. But I know that's not That's not how I felt comfortable practicing. Like I said, it was a line that I just couldn't cross. That wasn't just not something I felt comfortable with. If you're teetering on the line of starting your own business or leaving your current employer, the most important question you can ask yourself, especially if you're in a clinical practice, is well, not just if you're happy, but are you happy with the kind of care that you are currently delivering? If not, what level of care do you want to? What level of care do you want to deliver? Some people might be okay with giving, what I'll call C plus effort. It's passing. You're somewhere in the middle. But C plus effort often will result in C plus results, because I definitely think that you have to be comfortable with your level of care, and as long as you're in the end doing a decent job, I think that's the best that you can do, and good on you, essentially. But you also have to feel comfortable practicing that way. Believe it or not, I did try to essentially rationalize what the kind of care that I was giving. I was like, well, do I really want to, you know, see less people and providing excellent care, because that actually means that I'm going to help less people, and I've definitely had, some people, physicians mainly, critique my current practice. I mean, saying that, oh, my motivations aren't actually designed to help people, but, you know, I'm not really going to argue with people, because I think the results speak for themselves, in my opinion. But again, I'm trying to end each podcast with a thought-provoking question. Are you happy with how you're practicing? Is the level of care you're providing meeting your patient and your own expectations? I think we do have to mentally check in with ourselves. So the only way to know is to ask yourself, periodically. And again, if you are listening to my podcast, my sense is that you're asking yourself a bunch of questions. So I hope that this was helpful. Thanks again for listening. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.